Good afternoon, everyone. I am Gerky Louise Sanchez, BSN 3 Block B, and I will be discussing about encephalitis. Let's go to the first guide question. So, what is encephalitis? The cause, pathophysiology, clinical manifestations, complications, and how to manage encephalitis. So, let us go back to the anatomy of the brain. So, simplest anatomy. The frontal lobes are the largest lobes in the human brain, and they are also the most common region of injury in traumatic brain injury. The frontal lobes are important for voluntary movement, expressive language, and for managing higher level executive functions. One way to describe the functional organization of the frontal cortex is to divide it into three areas, each having specific brain functions. These are the prefrontal cortex, the motor cortex, and the Broca's area. The temporal lobes sit behind the ears and are the second largest lobes. They are most commonly associated with processing auditory information and with the encoding of memory. The temporal lobe subdivides further into the superior temporal lobe, the middle temporal lobe, and the inferior temporal lobe. It houses several critical brain structures, including the hippocampus and the amygdala. So, what is encephalitis? Encephalitis is inflammation of the brain tissue cells, most often caused by a virus, although it can also be due to bacteria, fungus, or protozoa. Encephalitis is a rare yet serious disease that can be life-threatening. Encephalitis is an inflammation of the brain tissue. Most common cause is viral infection. In rare cases, it can be caused by bacteria or even fungi. Encephalitis is an inflammation of the brain tissue. There are two types of encephalitis, primary and secondary. Primary, it occurs when virus directly infects the brain and spinal cord. Primary infections, encephalitis, common virus including HSV or herpes simplex virus and EBV, Epstein-Barr virus. Childhood viruses including measles and mumps. Arbovirus spreads by mosquitoes, ticks, and other insects, including Japanese encephalitis, West Nile encephalitis, and tick-borne encephalitis. So, the secondary encephalitis is it occurs when an infection starts elsewhere in the body and then travels to your brain. Secondary encephalitis could be caused by a complication of a viral infection. Now let us go to the pathophysiology. So here is the pathophysiology of encephalitis. So, virus invades the host at a site outside the CNS and replicate most, then reach the spinal cord and brain hematogenously. HSV, rabies, and herpes zoster virus are important exceptions to this. They travel to CNS from nerve endings in a retrograde manner. Once in the brain, the virus and the host's inflammatory response disrupt neural cell function. On gross examination, there is usually cerebral edema, vascular congestion, hemorrhage, infiltration with leukocytes or microglial cells is also a common feature. Following arbovirus encephalitis, calcification often seen especially in children. Herpes simplex tends to produce focal narcotic lesions, obvious intranuclear inclusions. So That is good. Yeah. So risk factors: infection, viral, fungal, bacterial, parasites, chickenpox, immune reaction, age, insect bites, mosquitoes, or autoimmune disease. So causative agent is herpes simplex virus 1 and 2. So what really happened? Okay, introduction of microorganisms to the brain leads to inflammation of the brain tissue, edema leading to swelling, and destroy the cells leading to bleeding in the brain, intracranial hemorrhage, brain damage that leads to encephalitis. And signs and symptoms is fever, altered behavior, altered personality, altered consciousness, new onset of fits, abnormal examination of nerve system. And the complication is permanent brain damage, hearing loss, and memory, speech, hearing, and sensation problem. So, I have a question. Why is age related to encephalitis? Kasi po, weak po ang immune system ninda, which leads to spread of the infection po. Kaya related ang age sa risk factors. So to make it simpler for you, I'll be showing the normal brain and versus the brain with cerebral edema. Encephalitis is most often caused by a viral infection which causes inflammation of brain tissue. The brain tissue swells, cerebral edema, which may destroy nerve cells, cause intracerebral hemorrhage, and brain damage. Viruses are usually transmitted by the following routes to the human host. Okay, so inhaling respiratory droplets from an infected person, contaminated food or drink, mosquito, tick, and other insect bites. Skin contact with an infected person. So, I have another question is, what part of the brain does encephalitis affect? Napakinggan ko kanina. Explain ko. So, common viruses. This form of encephalitis usually affects the temporal lobe, the part of the brain that controls memory and speech, and it can also affect the frontal lobe, the part that controls emotion and behavior. So what are the causes? So herpes simplex virus 1 and 2 is the number 1 cause. I highlighted it here. So enteroviruses, cytomegalovirus, CMV, toxoplasma, West Nile virus, rabies virus, tick-borne virus, HIV, and arbovirus. So clinical manifestations: fever, headache, nausea, and mental status changes. Meningeal signs: nuchal rigidity, stiff neck, photophobia, seizures, motor deficit, personality changes, size of brainstem involvement such as nystagmus, extraocular nerve palsies, hearing loss, dysphagia, and respiratory dysfunction. Patients with hypothalamic pituitary involvement may develop diabetes insipidus and hypothermia or SIAD. Complications: speech impairment, paralysis, lack of muscles coordination, personality change, problems with hearing, vision, and memory. So, how to manage encephalitis? Diagnostic exam: electroencephalogram or EEG and CSF examination. An EEG can be used to help diagnose and monitor a number of conditions affecting the brain. It may help identify the cause of certain symptoms such as seizures or fits or memory problems, or find out more about a condition you've already been diagnosed. Next is MRI, magnetic resonance imaging, to detect inflammation. Gadolinium-enhanced magnetic resonance imaging can detect different patterns of inflammation to differentiate types of encephalitis. So, blood cultures rarely identified as a causative organism, but brain tissue biopsy may indicate presence of microorganism. West Nile virus serologic testing on blood or CSF. Nursing diagnosis: ineffective tissue perfusion, hyperthermia, disturbed sensory receptors, anxiety, knowledge deficit. Depending on the type and severity of encephalopathy, common neurological symptoms are progressive loss of memory and cognitive ability, subtle personality changes, inability to concentrate, lethargy, and progressive loss of consciousness. So, fatigue. Risk for injury. Inflammation can injure the brain. Fatigue is closely linked to sleep disturbance and other consequences such as cognitive and emotional and behavioral difficulties. Risk for physical impaired mobility due to prolonged bed rest. Sa nursing interventions, so monitoring pupils and vital signs frequently to check for intracranial pressure, irregular pupils widening, pulse pressure, tachycardia, irregular breathing, hyperthermia, monitors patient's response to medication, monitor neurologic factor behavior or personality changes, weakness or cranial nerve involvement, Glasgow Coma Scale, monitor fluid input and output to ensure hydration, maintain quiet environment and dim light. Avoid excessive stimulation. Agitation can lead to increased cranial pressure 0 to 15. Maintain seizures precautions. Pad slide rails of bed. Have airway and suction equipment available at bedside. Maintain standard precautions and additional isolation. Administering antipyretics and other cooling measures as indicated. IV fluid replacement through reorient patient frequently. Elevate the head of the bed for lung expansion to decrease ICP and cerebral edema. Provide supportive care if coma develops. Encourage significant others to interact with patient even while in coma. Monitor and inform ATP for continuous degradation of patient's consciousness to change therapeutic management. Nursing interventions. Antiviral agent. Acyclovir, drug of choice for herpes simplex virus. Slow administration for 1 hour to prevent crystallization in the urine. Decrease dose if patient has history of renal insufficiency. Foscarnet or Foscavir IV for CMV encephalitis. Anticonvulsant to treat seizures. Phenytoin, dilantin for status epilepticus. Administer osmotic diuretics, mannitol, reduce cerebral edema. Antipyretics such as paracetamol, corticosteroids, dexamethasone to reduce cerebral edema and swelling. Sedatives and analgesics as supportive therapy, benzodiazepine, diazepam, or Valium, or lorazepam antibody. So this is the question. So, do people recover after encephalitis? In many cases, people make a good recovery from encephalitis. But nerve cells in the brain may be damaged. This can lead to long-term effects which are sometimes severe. Survivors of severe cases of encephalitis can be left with permanent problems such as fatigue, irritability, impaired concentration, seizures, hearing loss, memory loss, and blindness. The recovery process may take months and years. Why is age it's a risk factor in encephalitis. Yung kaninang sinabi po is, pag bata pa is mahina pa yung immune system nila, is edema irreversible. It can sometimes be treated with medication and rest. Brain swelling can be very difficult to treat. It can also cause irreversible damage. The swelling can occur throughout the brain in certain areas. Thank you.